गुड मॉर्निंग दोस्तों, मेरा नाम डॉक्टर रवि प्रकाश है। मैं एक फिजियोथेरेपिस्ट हूँ। BASMI is nothing but Bath Ankylosing Spondylitis Metrology Index. This scale is to assess the severity of ankylosing spondylitis. We are going to discuss 5 parameters or 5 tests which we'll be performing now. So the first one is cervical rotation test. So patient will be in supine lying position. We'll use inclinometer to assess the cervical rotation. So inclinometer is placed on the forehead of the patient. Patient should be looking upwards. We'll ask the patient to rotate the neck on one particular side, first left and then on the right side. We'll measure the ranges. Normal cervical rotation range is 80 to 90 degrees. If the patient is having approximately 70 degrees, then it is called mild dysfunction. If it is between 20 to 70 degrees, it is moderate dysfunction. And if it is less than 20 degrees, then it is severe. Now the second is maximum intermalleolar distance. This is to measure the hip mobility. So we'll ask, patient should be lying in supine position. We'll ask the patient to spread his legs as much as possible. If the intermalleolar distance is more than 120 centimeter, it is considered normal. If it is 100 to 120, it is mild dysfunction. If it is 70 to 100, it is moderate dysfunction. And if the distance is less than 70 centimeter, then it is severe dysfunction. Now the third test is lumbar side flexion test. So in this test, patient should be standing up against the wall, back against the wall. The fingers should be extended. Now the distance from middle finger to the floor is measured on both the sides, and then we'll ask the patient to do side bending, and we'll again measure the distance from middle finger to the floor. The difference between the two distances and average of both the sides will be taken. So if the difference is more than 15 centimeter, it is considered normal. If it is 7 to 10 centimeter, then it is mild dysfunction. If it is 5 to 10 centimeter, it is moderate. And if it is less than 5 centimeter, then it is severe dysfunction. Now the next test is lumbar flexion test, or you can say modified Schober test. Here in this case, we'll ask the patient to stand. We'll see for the dimples in the lower back, that is PSIS. Will mark a point between the two dimples and will measure 5 centimeters below that center point and 10 centimeters above the center point. We'll measure the distance between two, and later we'll ask the patient to flex as much as possible, and we'll again measure the distance. The difference between two is considered. If the difference is more than 5 centimeter, it is considered normal. If it is 4 to 5 centimeter, it is mild dysfunction. If the difference is 2 to 4 centimeter, it is moderate dysfunction. And if it is less than 2 centimeter, it is severe dysfunction. Now the last test is tragus to wall distance. It is basically to check the thoracic mobility. Here the distance from the tragus, the anterior portion of the ear is called tragus, will be measured from the wall. So patient will be standing up against the wall. The shoulders should be completely attached with the wall, hips and heels together with the wall. will measure the distance from the left tragus to the wall and then right tragus to the wall. We'll take the average of these two and that measurement will be considered. If the tragus to wall distance is less than 15 centimeter, then it is mild dysfunction. If the difference is 15 to 30 centimeter, then it is moderate dysfunction. If the difference is more than 30 centimeter, then it is severe dysfunction. Now let's talk about Laslett cluster. In 2008, Laslett was the one who performed cluster of tests which are called Laslett cluster. These tests are evidence based and are basically for the diagnosis of pain in SI joint. The first test, sacral thrust. In this, the patient will be in prone position. Therapist will apply force on the sacrum and the force is directed anteriorly. The positive sign will be if there will be reproduction of the pain. The second test is SI compression test. The patient will be in side lying position and knee should be slightly bent. The therapist will place both of his hands on the pelvis of the patient and force is directed vertically downwards. Reproduction of the pain is going to give you positive result. Third test is SI distraction test. Here the patient will be in supine lying position and then therapist place both of his hands on ASIS of the patient. Therapist will be applying pressure in posterolateral direction. If there will be pain over SI joint, then this test is considered positive. The fourth test is thigh thrust. In this, the patient will be in supine lying. The therapist will place patient's hip and knee in 90 degree of flexion and the therapist will apply force in posterior direction through the femur at varying angles of abduction and adduction. Positive sign will be reproduction of the pain. Gainsland's test. In this, the patient will be in supine with both legs extended. The test leg is now brought passively in full knee flexion position. Opposite hip will be in extended position. The pressure will be applied on the flexed extremity. Reproduction of the pain will give you positive result. Now the sixth one is active SLR test. Patient is in supine position. The therapist will verbal cues the patient that he has to raise his leg upwards, keeping his knee locked. Patient has to feel the discomfort and now the therapist will stabilize both the pelvis of the patient and the patient is again asked to raise the leg. Reduction in the symptom or discomfort is considered positive test.